Most likely, you may be brushing wrongly, and I'm sure not efficiently.
Before I discuss the brushing, I would like to tell you about the gingival sulcus. Gingival sulcus is a place which is at the union of the tooth and the gum. Look, I'm going to do it. It's this space. So look again. We have to clean this space because this contains the maximum number of bacteria. All the three methods that are listed here are required to efficiently brushing. Either you can do all the method together or one by one. The first method is you take the brush. This has very thin bristles on the top, whereas the base it's thick. And the bristles on the top, which are thin, they go into the gingival sulcus. The bristles of the brush are placed at an angle of roughly 45, and they are just rotated with short horizontal strokes. Look, I'm going to do it. Look how the bristles go into the gum and they clean it. Now I do it in a little brisk fashion like this. What we do is we start from one side. Let's see, in this case we start from the left upper side. We give 7 to 8 movements like this, short horizontal strokes, and move half a foot forward and use the same movements here, and after doing it 5-6 we move half a tooth forward, and likewise we keep doing it like this, like this, like this, and we turn it like this and keep going backwards now till the last tooth. Same short horizontal strokes. Then we move the brush towards the palatal side and do the same movements 1, 2, 3, 4, 5, 6 and move half a tooth forward and keep doing it like this and keep coming forward. We are moving half a tooth forward after 5 to 6 strokes. Now we turn the brush and repeat the same movements, and likewise we go to the last tooth. Likewise you do the lower teeth. Same short horizontal strokes. And don't break the sequence again, because if you break it, you tend to lose a tooth and that tooth becomes bad. After doing here, move towards the lingual side, to the tongue side, and keep doing it with the short horizontal strokes as I have explained in the upper jaw, and go to the last tooth. Now it's very important to note that if you do not have a brush like this, even with an ordinary brush, the same movements can be performed. And if it bleeds, as you have seen, that it has bled in this case, you have to tell the patient, you don't have to worry about that. Keep doing it, and after about 1 or 2 days, the bleeding will automatically stop. So we need 3 methods of brushing. The second method is that we put the brush horizontally into the spaces. Look, I'm going to put, and make small circular movements like this. Small, not big ones, small like this. And this is clockwise, and then you do anti-clockwise. Slowly and gradually you learn this method. There is no difficulty. Look, I am doing it very quickly now. And see how much the foam has come out. The third method is that you put the bristles on the gums, as I put here, and slowly move them so that they pass through the crevices of the teeth, like this. So I'm going to do it a little faster for you. Now coming back again, I'll repeat all the 3 methods once again. First is the short horizontal strokes, look. Second is putting at a right angle, small rotatory movements clockwise and anti-clockwise. And the third is putting the bristles on the gum and straightening them so that they passes. Three methods can be done simultaneously or individually, that you finish one method first and then do the second method and third method. But they have to be performed to have an optimum cleaning of the teeth. Now I'm going to tell you a very important thing regarding brushing. First of all, what you do is you put little toothpaste on the brush, right? On the bristle, very little toothpaste, and brush your teeth with all the three methods. Say about for 1 to 2 minutes and rinse. After this, all the three methods that I have just shown you, you have to do it without using the toothpaste. No toothpaste is used. You keep doing it. This, we call it dry brushing. Let me explain you why do we do dry brushing. First of all, why do we brush our teeth? We brush our teeth to reduce the number of bacteria in the mouth. And the bacteria in the mouth lie in abundance in everybody's mouth. They get removed with the friction action of the bristles of the brush, by the physical action. Now, coming back to the dry brushing, when you are doing dry brushing, the bacteria will get dislodged from the surfaces of the teeth and will fall into the mouth. Once they fall into the mouth, the person or the patient has to go near the wash basin and spit. And like that, you keep doing it for at least 3 to 4 minutes. This reduces the number of bacteria in the mouth.